Hello, I am Dr. Rasa and today I am going to discuss with you non-pharmacological treatment of high BP. According to American Heart Association and American College of Cardiology, new definition of hypertension is a blood pressure reading of 130 by 80 millimeters of mercury or higher. The American College of Cardiology and the American Heart Association now divides blood pressure into 4 general categories. First category is normal blood pressure, in which BP reading is lower than 120/80ths of a millimeter Hg. Second category is elevated blood pressure. In this, systolic BP ranges from 120 to 129 millimeters Hg and the diastolic BP is below, not above, 80 millimeters Hg. Third category is stage 1 hypertension. Here systolic BP ranges from 130 to 139 millimeters Hg or the diastolic BP is between 80 and 89 millimeters Hg. Fourth category is stage 2 hypertension. In stage 2 hypertension, systolic BP ranges is 140 millimeters Hg or higher or the diastolic BP is 90 millimeters Hg or higher. Blood pressure higher than 180/120ths of a millimeter Hg is considered a hypertensive emergency or crisis, and anyone with this much BP needs to go to emergency. The updated guidelines don't offer different recommendations for people younger or older than age 65. Treatment of second category or elevated BP is implementation of non-pharmacologic therapy and reassess the patient in 3 to 6 months. Medications are recommended to lower blood pressure in stage 1 hypertension or third category if you've already had a heart attack, stroke or peripheral artery disease including carotid artery stenosis, or if your 10-year risk of a heart attack is higher than 10%. You can find your 10-year estimation at www.cv-risk-calculator.com. For others with stage 1 hypertension, the first action is to adopt non-pharmacological changes seriously. Untreated, high blood pressure increases the risk of heart attack, stroke, retinopathy and kidney damage. It's important to have your blood pressure checked at least every 2 years starting at age 18. Predisposing factors for hypertension are advancing age, men and postmenopausal women, family history of cardiovascular disease, sedentary lifestyle and psychosocial stress, smoking, high cholesterol diet, low fruit consumption, obesity and weight gain, coexisting disorders such as diabetes, and hyperlipidemia, high intake of alcohol. Non-pharmacological treatment of high BP. Here I want to stress that you can use non-pharmacological measures to reduce BP in second category or elevated BP and in some cases of category 3 or stage 1 hypertension. Don't delay starting pharmacological treatment if non-pharmacological treatment fails, as high BP can cause damage to various organs of body which are irreversible. In non-pharmacological therapy, address the predisposing factors discussed above. In addition, following measures can also be helpful. Limit intake of foods rich in saturated fats and cholesterol, increase consumption of fruits and vegetables and include whole grain food in your meals. Other recommendations include consuming low-fat dairy products, poultry, fish, legumes, non-tropical vegetable oils, and nuts, and reducing intake of sweets, sugar-sweetened beverages, and red meat. Make sure you have adequate intake of calcium, magnesium and potassium, which help lower the BP. If you are taking well-balanced diet, you don't need to take supplements. Also keep in mind that many kidney patients have high BP, and potassium and magnesium can get excessively elevated, and one should follow doctor's advice who may ask you to restrict potassium and magnesium intake. Relaxation techniques of yoga, acupuncture, tai chi, mindfulness-based stress reduction program, and transcendental meditation or mantras are also helpful in reducing BP.